civil society activists, we must be battle ready. Because you don't need a briefing to articulate what we always advocate on a daily basis. I just want to also underscore one key important point, which is that you said, which Dr. Kalula indicated in his speech, that this NHI, as part of universal health coverage, it should ensure that health is not a privilege for few, but a right for all. And if there is something in our lifetime that we must have done, is to ensure that people who have a need for to access healthcare, they do get that particular access. So let me call people that are in the lead for ensuring that healthcare is provided at all material times. Dr. Mnisi is our next speaker. Where I come from, there would have been a hand raised. Chairperson, can I say something? Why is the panel so male dominated and only one female? So I was not the one who put the program together, but it could have been worse that the panel would only be males. But you are here, you represent the health professionals on behalf of Samatu, Dr. Mnisi.
Thank you, Chair of the session. And I wanted to start off with a song, but given the reason that you've only given me 15 minutes, now I can't even sing my song. I'd like to greet everyone here today. I have so much to say, but what I'd like to start off by stating is that I'm so privileged and welcome to be here today. Not because of age, not because of gender, but because of the importance of universal health care coverage in our lifetime. One of the most momentous and important occasions that happened in the 20th century was the Alma Mater Declaration, in which hundreds of countries from all across the world and stakeholders in the healthcare sector found themselves united in one voice to realize that in order for the world to continue and the world to reach the goals that it wants to reach, primary healthcare has to be focused on in order to ensure health for all. And it's only befitting that today, on this momentous occasion, we find the theme of this day being health for all, where it's not only a declaration, but a time in which you move paper into action. And in my lifetime, that is what I want to see. So let me get straight to it. As I've been introduced, my name is Dr. Nkateko Mnisi from the South African Medical Association Trade Union, better known as SAMAT. We have declared, and yet again, we remain and declare yet again, in the fact that we are resolute and remain resolute in confirming and affirming the cause of doctors and healthcare professionals throughout the country in the public healthcare system, but also that we support universal health coverage. I say that again. I didn't hear any hands of applause. We are here to affirm and show that we are resolute in wanting to see universal health coverage. So I just want to paint a picture of how the world is currently and the inequalities that we face. In our current workplaces, I believe some have been highlighted by the previous speakers, we find ourselves having so many inequalities. In our workplaces as healthcare professionals, we find a situation which is unjust, where in our public healthcare systems that serves more than 80% of our country, we find that we are lacking resources, both in equipment, but also in human resources. We find a place in which the reality is a lot of doctors are facing unemployment as I speak to you here, as well as nurses. We find a space in which casualization of healthcare workers is happening, and it is unjust. We also find a space in which Kokwani, for those that don't understand Tonga, a grandmother from the rural villages, is finding herself having to wait more than a year just to be seen by a specialist gynecologist for cancer which can have a solution. We find theatre cases being cancelled because of what? Lack of water in particular infrastructures, or even because we don't have enough linen, or we don't have enough specialists. Is this a fair reality that majority of South Africans should face? No, it is not. And the reality is that we need to be the stakeholders and the people that ensure that in our lifetime, when I am that grandmother, I cannot be going through that situation. No, 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 no. Not under my watch, not under Samatu's watch. So we are here to say yet again, health, if it is one of, in fact it's not one of, it is the most important commodity that we have in our lifetime. Health is the ultimate source of wealth. It should not be something that we use in order to make our pockets deeper. No, 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 no. It is a commodity that we need to use to ensure that every single person in this world has access to quality health. This is a commodity we can use to improve our life expectancy as a country. If we want to be the economic powerhouse of Africa, how else can we do it if people don't have access to healthcare? I hope I'm still on time. Thank you, thank you, thank you. There are so many things that need to happen in NHI in order to ensure that universal health coverage is successful. And we as a union are here to be the observers and the stakeholders that are there to ensure that government ensures good governance and ethics throughout this particular period and implementation processes, but also that we have a multi-sectorial and multi-organizational approach to this. When I say this, we cannot have NHI that works so we're only focusing on the element of the finances. We also need to look at our infrastructure. We need to make sure that every single health institution here is of good quality. When we implement it, we need to ensure that Kensani Hospital, we need to ensure that every single district and CHC all throughout this country is easily accessible, that the transport systems are easily accessible, but even to say so, you don't have to have people having to carry you to make sure you're able to get to that particular access. We also need to ensure that all sectors are well covered in order to ensure that this works out well and that universal health coverage is successful and a reality that we all want to see. So with that said, I want to again re-emphasize, as Samatu, we are here to support UHC. We are here to ensure that NHI is a successful and well-implemented bill and hopefully future act in which that will drive us and take us towards this. And with that said, as a unionist, I cannot leave here without saying, Aman.
Thank you, Dr. Nisi, for those words that call on all of us, especially those in the medical profession, be they doctors, specialists, nurses, to honor their calling. As you said, health is the ultimate source of life. Wherever they are hiding, and those that may have booked their tickets to leave, as it happened, somewhere somebody says 2024 is our 1994. We must say 2023 is our 1993. And Comrade Godfrey has indicated that because in 1993 many were hopeless. Those that had enjoyed the privilege of being beneficiaries of apartheid, they could see only doom and gloom, but they are still here. And the IEC, as you correctly pointed out, was an institution that no one knew what it would deliver. And what it has delivered is what we all wanted it to deliver, to be a credible organization that ensures that politicians can do whatever they want to do. But when the IEC pronounces, all of them, they accept that particular pronouncement. And those who will serve in the administration of the NHI and those who will be the foot soldiers of the NHI, we must not talk about the health system that people in Cuba experience. We have an opportunity to actually live it in our lifetime. So without much ado, let me call on Dr. Ona Sukari. It is my honor, sir, to call him to the stage.
Thank you very much, Program Director. I'll try my best to honor the 15 minutes allocated. And I think the only way I can be able to do that is to stick to the script. Because when I talk NHI, I can be integrating the whole bill and find myself really talking for hours. So I'll try my best to just stick to what has been prepared and in relation to the theme of today. First, to pass my greetings to the Minister in absentia and other officials from the National Department of Health, the World Health Organization representatives that are here, dignitaries, and to all delegates gathered here today to commemorate the Universal Health Coverage Day. It's not easy for one to introduce himself, so it's better for other people to talk about you and introduce you. But allow me to introduce myself. My name is Dr. Onas Mukari, a qualified dental therapist and a medical doctor from Medunsa, now known as Fako Mahato Health Sciences University. Currently, I'm doing my final year in postgraduate diploma in health economics at the University of Cape Town. I'm a council member of the Council of Medical Schemes, and our registrar, our CEO is here, Dr. Kabani, and our chairperson, as introduced, Dr. Mabiba. Today, I am standing here in front of you, representing the Progressive Professionals Forum, which is an organization of academics, business people, doctors, specialists, other healthcare workers, and other professionals. I am currently the PPF NHI National Task Team Convener. I am not alone, but I'm accompanied by other members of the PPF NHI National Task Team who are here, and I would also like to take this opportunity to introduce themselves. I am with Dr. Atlanta Kumalo. I'm also with Dr. Nomfundo Tlapo and Mr. Benjamin Magoye. Thank you, colleagues. On behalf of the PPF, we want to thank the National Department of Health to passing the invite to us as to represent the view of professionals in terms of NHI and universal health coverage. We found the theme of today very relevant, which is health for all and time for action. And we believe that we have had this kind of gatherings before, many, whereby we are talking about NHI. We have had many interviews. Our people have heard us. Some of them, when you meet them in the streets, but I can't think NHI will ever become a reality. But I think the theme is very relevant. That time, now is time, and time for action, not time for talking. We believe that with the progress that has been made in the legislative framework, time shall come whereby our people must start feeling national health insurance. The progressive implementation must start. And when we speak, we must speak about certain sectors of our people that are benefiting. Even if it means just starting with pregnant women and children only, or elderly people, or people with disability. But if we can take one sector at a time, and our people realize that, no, this thing is working. Pregnant women and children are benefiting from it. They are accessing public health care, the quality is improving, they are accessing private health care without any financial hardships. We think as PPF, it is about time that we don't talk, but we implement. We think it is the time whereby our people should sing, whether they're in churches or in shepherds, but in NHI, years and but NHI, years and meaning that they will see pregnant women and children and elderly people and the disabled people benefiting from NHI, and it will give them hope that nayo izofika kubo. It will be a good song for our people, for it will give them hope. They will know that the next category now is Wafike. We always say this. During COVID, everyone was crippling to get the vaccines. But it started with certain categories, the old age, comorbidities. But we all had hope that Nati is Ofika. And finally, our 10 came, and all of us ended up receiving vaccines. So we think that NHI should take that route. We must start giving our people hope. Sorry, Program Director, I went off the script. The Universal Health Coverage Day is dedicated to celebrating the progress made by different countries towards achieving free quality health care for all, and to increasing public awareness of the necessity for equal, equitable, efficient, and effective health system dedicated to the progressive realization of universal health coverage for all population across the world. It is important that we communicate that universal health coverage or national health insurance is not a South African phenomenon. Those that are opposed to NHI portray it as such, that we as the South African government is taking chances, while the South African government is doing what every country in the world is doing. The world is at the midpoint of 2030 United Nations Sustainable Development Goals, and we are gathered here today to reflect on a decade of progress, challenges, and opportunities that our country has made in advancing towards universal health coverage. It is important to South Africans to understand the strategic objectives and goals of the universal health coverage in order to understand what the national health insurance seeks to achieve in moving the country towards universal health coverage. The World Health Organization defines the universal health coverage as the measure of ensuring that all people can use the health services they need when they need them, and that these services must be of sufficient quality to be effective, while also ensuring that the use of these services does not expose the users to financial hardships. This is exactly what the National Health Insurance seeks to achieve for the people of South Africa. One of the arguments by those against implementation of NHI is the concern about healthcare quality. This criticism ignores many clauses in the NHI bill about the provision of quality health services and the requirement of licensing, certification, and accreditation of service healthcare providers to comply with quality norms and standards. By requiring contracted service providers and health establishments in both private and public sectors to meet minimum certification and accreditation standards, the NHI aims to ensure that service providers deliver high-quality care, health outcomes-based remuneration, health outcome-based remuneration of service providers, and services monitoring is essential for ensuring that contracted service providers deliver high quality of service. The national health insurance alone cannot achieve universal health coverage. It is important to understand that national health insurance on its own is not a health system, but the national health insurance is one of the building blocks of the health system. It's actually the financing aspect of the building blocks of the health system. We still need the strengthening of the health information systems, which is critical to implement national health insurance.
But on the other hand, there is also a much more vociferous resistance and noise from those who, amongst them, serious benefactors of the current system, especially from a financial and business point of view. We fully understand the fact that several individuals and companies have companies, and also including their shareholders, some of whom are listed companies, do have a lot to worry about, having invested a lot in the medical financial systems, the medical aid industry, and also some of the major providers of health services are concerned in terms of whether they will be able to, continue to thrive in the businesses in which they've invested quite a lot. Many of those have become quite lucrative, much more profitable in this country than even the most developed economies of the world. We know that some of the companies which thrive in terms of their current systems, actually some have tried to establish in other parts of the world, in Europe, in the Americas, and elsewhere. But because some of those countries have already progressed in terms of making sure that health is treated as a public good rather than a profitable commodity, even some of those companies could not thrive as much as they do here in South Africa. So it's understandable, that anxiety, that if you've invested and you're used to significant profits and to yourselves and to your shareholders, anything which threatens that will become a concern. So we're not surprised that some of those are already saying that indeed they are going to challenge this particular legislation because it threatens their livelihoods. So that's the nature of life. We do understand that. But of course, that is the story of our country, that various independent studies do assert the fact that we are one of the most unequal countries in the world. One may differ. I know some analysts go further to say, and it's often repeated, well, I'm not an expert in that area, but I have my doubt, to say that South Africa is the most unequal. I know that those assertions are being made, but I would not, differ with those who say we are amongst those. But of course, we know that not all countries are subjected to some of the institutions which we are members of, where we can, our Gini coefficient and all those things can be assessed. So, and the fact that this intervention of NHI is amongst instruments which try to bring equity, especially in the provision of health services. But as a constitutional democracy country, we must accept that our system makes room for even the most transformative of legislation to be challenged in our courts, especially by those who have deep pockets. We have seen that happening at various turns in terms of various reforms in our country, including black empowerment legislation, procurement legislation, all those. Some of those have actually been struck down and they have to be reformulated because we are a constitutional democracy. So as I said, the fact that even in this case, those who are aggrieved will probably go forward, and we must be ready for a real long battle in this regard. So we are not oblivious of that fact, that it's going to be a long battle. But the passage of this bill that just set the stage for earnest construction of the basic building blocks in our country for universal health coverage. We will continue to engage those patriotic South Africans who have genuine concerns about various issues, including the risks of failure, concerns about possible inefficiencies, corruption, and other risks which are inherent in an untested system. We do acknowledge the fact that we do have as a country serious challenges, especially in the area of rampant corruption. And that's why There are various institutions which are being created, including the State Capture Commission, which was chaired by current Chief Justice, to try and address this issue. So we're not, again, we are not ignorant of these risks and ready to engage with various concerned South Africans to deal with these matters. We also do understand clearly that the NHI is not going to be a silver bullet, that it will not solve all our perennial problems, that there is no shortcut for real painstaking building an efficient health system, managing our scarce resources prudently, deploying the right people in the right positions of responsibility, and giving them the tools of trade, including proper delegations with the attendant checks and balances. Because part of the inefficiencies in many of our institutions in the public service is also related to some of these issues which we are attending to, but we must focus on and deal with. Because just simply implementing a new system does not take that away. We have to focus on that and make sure that these matters are dealt with and are attended to. Of course, there is also, as we debate various platforms, also often stated threat of losing a number of health professionals. Sometimes it may be exaggerated, but it is a reality that it's something which we cannot ignore. And of course, if you are in a situation where over time the kind of way in which we have conducted, especially our private service provision, has been in a manner that institutions and individuals could really make as much money in a very unregulated way. Almost some of the practices, not in line with, some of our ethics, the Hippocratic oath and other oaths which Dr. Masike must look after that we are in line with. I think there's, a number of reports of, so the inefficiencies, the poor practices, and in the public health system, which is quite seriously overwhelmed, numerous to show. But also when we look at this issue of the threat of losing some health practitioners, I would argue that any health professional, medical, nursing, pharmaceutical, and all other health professions, any health professional conducting themselves ethically, both not just in the public but also in the private practices, have nothing to worry about. But anybody who is caught up in the rat race of accumulation, which our current systems makes even us as professionals open to. I'm sure all of us gathered here know of various stories by institutions, some of which have also been in the public domain. Some of this respectable private providers. Some are still fresh in the mind, still doing rounds even now about various ways in which information is cooked to make sure that they can charge higher. It also happens even amongst the most well-trained professionals, and I'm sure leaders like Professor Tijafa and all leaders of the medical schools and the College of Medicine sometimes will feel ashamed of some of us. The kind of ways in which we go to the extent in terms of extending, beyond the ethics of medical practice. So, in terms of what our current systems make room for, it is not therefore, surprising or unexpected that some of us who have now got accustomed to those opportunities, anything which goes anywhere close to closing those kind of windows of exploitation may consider, leaving the country. But as Dr. Kalua was saying, the move towards universal health coverage is not a South African move. The move towards making healthcare a public good rather than a commercial commodity, it's a worldwide move, agreed at the WHO, United Nations, September 2019, commitment made by head of states through a political declaration. Just 2 months ago, on the 21st of September, we were back at the UN, myself and President Ramaphosa were there, again called by the UN Secretary General to come and recommit to the attainment of SDG 3, especially SDG 3.8, which speaks about commitment to universal health coverage. So this move is, unfortunately for those of us who think it's just a South African direction, I'm sad to inform those colleagues who think they may, in pursuit of the motive, the profit motive, may go to other countries. When they arrive there, they will find UHC unfolding. And some of those opportunities which may have been there in the past, the door is closing because this is a commitment of the world. So unfortunately, I've got that bad news to those who think that there's going to be. There will be, of course, from time to time, some small part of the world. I would say, as I think one of the experts mentioned last year when we met in the Ekurhuleni, that we are an outlier as South Africa in the rampant practice of commercialized health services. The nearest to us is a country called the United States of America. But sometimes we're even more than the US in terms of the kind of practices which we allow. So I would want to say, we look at the passing of this National Health Insurance Bill, soon to be an act, as laying that foundation for us to implement what we have long committed to and what many countries of the world have long committed to. And I would want to urge our colleagues, the various health professionals, to take it easy, that this is going to be handled with the necessary care to make sure that the best of what we have, both in the public and the private, is preserved, but we discard the worst of what is there, both in terms of the public and the private. We know that the public health system carries the large 85 to 90% of the needs of the country, but there's also some very good experiences, both in the financing. So I'm quite convinced that as we set up this national health insurance, a lot of the experiences with various companies which have set up very successful, private health insurance systems, monitoring, looking at how, they function, administer. It would be foolish not to want to learn from some of those, the best practices out of that, but take out the worst of it. So, really, I'm hoping that with all the speakers who are going to be speaking later on, that we will be able to, strengthen our commitment and also look at what kind of building blocks we need to put in place now that we have the legislative framework in front of us, notwithstanding the challenges which are still ahead of us. So, appreciating also the theme from the WHO, Health for All, Time for Action, agreeing indeed that this is, we have talked enough. We've had conferences, high-level meetings, workshops. I think now that we have this bill now, behind us, except for the final stages, this theme is very relevant for us.